Liposuction looks very easy because what's the big deal? You put a tube in there and you move it around and fat comes out, you know. But it's actually sculpture because you're trying to create a perfect contour and a smooth surface. You need a good eye, you need meticulous technique, you need to take your time. I use tiny cannulas so that only a little bit of fat comes out at a time. I do some liposuction and we look, and we do a little more and we look again, very slowly until we have achieved the desired contour. The results of liposuction are permanent, which means that liposuction removes a few million fat cells which don't come back. Along with liposuction, I use a technique called superficial microtunneling, which creates a mesh of tunnels right under the skin. And what the superficial microtunneling does is it tightens the overlying skin somewhat, which is very useful, for instance, in the inner thighs, in the arms, and in the neck. We also use thermage, a device that delivers radio waves to tighten the skin. The procedure I use is called tumescent liposuction, where we inject a fair amount of fluid into the tissues before liposuction. The fluid eliminates bleeding and eliminates pain. Each individual area typically takes 20 to 30 minutes. After surgery, you spend a couple of hours in our recovery room, and then you go home.